Coming up, we'll be on location at the spine and pain clinics of North America, discussing the latest advances in pain management and how they can effectively treat many types of pain and help restore your active lifestyle with one of this area's top doctors, Dr. Majid Ghauri. Welcome, Dr. Ghauri, to the Top Doctors Interviews program.
Thank you for coming out and interviewing us on this day, and we appreciate that.
Absolutely. We look forward to this because there's so much great information to talk about pain management and helping people with different types of pain issues. But before we begin with that, I just wanted to kind of talk about your background. You've established a reputation for excellence, Dr. Ghauri, for helping patients, treating their pain, improving their lives, bringing their active lifestyles back, truly changing lives as well. And you're recognized as a top doctor for pain management throughout not only Northern Virginia, but throughout the DMV region, helping so many patients. So I wanted to begin, Dr. Ghauri, by asking you if you could please share your vision for your practice.
Yeah, as the name says that it's Spine and Pain Clinics of North America, and the acronym goes as SAPNA. And in Urdu is my mother language. It means a dream. So it by itself incorporated that one day we're going to have a multifaceted and a comprehensive spine and pain program, whereas everything is available that is done anywhere in the country, and the patient doesn't have to feel limited by just coming in and either have injections done or have medications done, or doesn't have a spine person to go to or a surgeon go to, or for that reason an orthopedic person for joint pain to go to. For that reason, I called it a Spine and Pain Clinics of North America, because I really wanted to bring every possible expertise in my practice and have I have a loose relationship with a lot of consultants, but eventually bring them all under one roof. And the second thing, I really wanted to make sure that whether the patient is able to pay or not, I take Medicaid, I take Medicare, I take all commercial insurance, and those who are indigent, I still see them. If they don't have the means to be able to provide for their care, I actually participate in a lot of charitable organization and screen those patients and welcome to my clinic if for some reason they are unable to pay for their care. So our vision is beyond just a normal every paying patient, but beyond that, anybody who needs help, we want to be there for them.
I really love that approach. It's truly patient-centric. It's like the doctors really that care about their patients instead of just getting them in and out the door. Unfortunately, like many practices in today's day and age do, it's truly being a top doctor. Let's begin with just the basics, Dr. Ghauri. What is pain management for those that don't know?
Yeah, so just going back and looking at how many of our colleagues or our countrymen in America, about 6% of Americans suffer with some kind of a pain in their lifetime. And when it comes to about, that goes to about 25 million patients a year that you will see that suffer from chronic pain that needs help. Pain management is a comprehensive branch of medicine that involves a multifaceted approach to help with not necessarily just acute pain, but mostly chronic pain. Chronic pain is a pathological phenomenon that went past certain time period, in an expected time period of a healing, if the patient still suffers with the pain, we considered it pathological pain. And we aggressively treat that with multiple ways so that we can stop the progression of this pathology and does not affect the livelihood of our patients. And the sooner you get to those patients and aggressively address that, the better the outcome is always. And so pain management basically is a comprehensive program that involves, as I said, multiple different specialties, from physical therapy to medication management, to injections, to sometimes even surgery, And now the regen medicine is also a part of this whole group of therapies that we offer our patients to get back to their normal life as fast as possible.
Spine and Pain Clinics of North America, located here in Fairfax, Virginia, is a state-of-the-art practice, Dr. Ghauri.
Okay.
You help a lot of patients through not only invasive but non-invasive treatment options as well, and you're advanced as far as your techniques and your approaches. Can you please tell us about some of the most effective treatment options that are currently available?
As I was saying, obviously, it's not that every patient is going to need the same treatment, but from simple physical therapy all the way to neuromodulation, intrathecal pumps, kyphoplasties and stem cells therapy, short of surgery, and we have minimally invasive spine procedures like Vertiflex and Zip that came out for spinal stenosis. We provide all those from minimally invasive procedures to advanced spine procedures that are done by interventional pain procedures here in Fairfax.
And what type of problems or issues do those address?
So most of the time we see patients with chronic neck and back pain. That is the most common etiology you're going to see. In a layman terminology, it's going to be either a pinched nerve or an arthritis. And also narrowing of the canal, which we call spinal stenosis. So most of the treatment are geared toward one of these three pathologies in the spine. And whether it is a simple epidural, which is a steroid injection, or it's a radiofrequency ablation, which addresses the arthritis, or it's a neuromodulation that addresses after somebody has had surgery and is not improved after back surgery or neck surgery. These patients benefit tremendously from advanced neuromodulation.
What I love about your practice, Dr. Ghauri, is that you really take the time with each patient because you understand that each patient is unique. Their type of pain is not a cookie cutter type of pain that you can just apply one size fits all. So you really sit down with each patient to identify what they're experiencing, what the causes could be, just really drill down so you can best put together the best treatment option for them. Are the procedures or treatments performed here, Dr. Ghauri, and how long do they typically take?
Yeah, if it's not a surgical intervention, then yes, they are done here in my clinic. And it could be as little as 5 minutes to all the way 45 minutes to an hour.
Oh, okay, that's not bad at all. And then when can patients begin seeing results?
Again, it's variable. Some procedures you start seeing good relief within 24 hours. Others, they take some time because the technology is meant to work that way, that it is a slow healing process. Like an epidural, you will see a good relief within 24 hours if it's going to work for you. And for a radiofrequency ablation, it may take you 4 to 6 weeks before you have a good remission of your pain. And that could get you up to 80% remission of your pain in 4 to 6 weeks, but you're not going to see it right away after the procedure.
And I know this varies based on each patient and their situation, but how many treatment sessions are normally necessary for a patient to see the benefits?
Any intervention we do, we like to reevaluate patient 2 weeks later. We want to make sure everything we're doing, we're trying to get the patient to the path of healing. We want to start a healing process because body heals by itself. There is very little that we can fix in pain management. Our interventions are geared toward putting them toward the path of healing. So if one procedure is putting them in a state where they have a 50% reduction of pain, they may not need any further intervention. All they need is a good care of their spine or the joint, and they may not have to repeat their procedure for a very long period of time.
These sound like great options for patients that are experiencing pain. What would you say, Dr. Ghauri, are the benefits of these treatments compared to other options?
Obviously, our goal is to get a person back on their feet and not miss out on their work as soon as possible. It's the more aggressively we treat those patients who are especially gainfully employed, or even for that reason, able to go back to the activities of daily living, the better these patients do. And we have tons of studies showing that when you are able to restore functionality sooner, these patients do not suffer from chronic pain, and they tend to go back to work very fast. And if somebody has been down for a couple of months, it's very hard to get these patients back to work. So in any given situation, our goal is really to restore functionality as fast as we can. And yes, patient can sit and wait on it. I'll give you an example. We do a procedure called kyphoplasty for elderly people, especially with osteoporotic spine fractures. These patients for many, many years back in 50s and 60s and even 70s were managed by bed rest and a back brace, and they tend to develop clots in their legs, have a pulmonary embolism, and ended up dying. Now with the advent of technology where we are aggressively able to do these procedures like kyphoplasty, next they're up and about. They don't even have to wear a back brace. So this is how significant a procedure can be in a life of even an elderly patient, let alone if you look back, if somebody is gainfully employed, how much he wants to go back to work. So there is a huge need for early intervention, in my opinion, in those patients so that they can have the back to normal life as soon as possible.
Yeah, that's wonderful. I mean, you're really restoring people's lives or changing their lives, and the advances are very impressive. I mean, in the past, like you said, people were subject to bed rest or back braces, and now they can be back on their feet, live their lives, see their grandchildren, their families, travel, and whatnot. So it's great to see that those options are now available for the patients. And also, those results seem really great as well, because you're helping so many patients in the community. How long do these results typically last? Is this something that's long-term?
Yes, our goal is to get people back toward their normal functionality, at least able to do activities of daily living. And once they're back on their feet, we tend not to see them returning over and over. But it's not unusual if somebody has gone through multiple modalities of treatment, especially if you have a failed spine surgery. There it becomes tricky. We do multiple different interventions to restore their functionality and maintain at a certain level. These are unfortunately the patients that probably will need more interventions than what we would see in some other patients. But neuromodulation has been fantastic in these patients. There are a group of patients like CRPS, complex regional pain syndrome. Again, neuromodulation has been phenomenal in these patients, getting back and not have to come back for more procedures. Once they are stable, they essentially can have back to normal life, provided something bad happens again.
That sounds really great. I mean, as I mentioned, pain can be so debilitating. It really is something that's very difficult for people to live with, and it causes so many issues, whether they can't go to work or different aspects of their life, they can't be active. So what you're doing is helping so many people in this community. And on that note, Dr. Ghauri, I want to thank you so much for joining us and being a guest today on the Top Doctors Interviews.
Thank you so much, Anik, for coming over. I appreciate you including me in this interview. I hope that everybody in the community actually hears our voice and is able to join us in this campaign that we have started, that nobody should be suffering from pain, irrespective of their ability to be able to pay or not. And that's what my goal is eventually.